There is new national data out tonight about a rare but serious condition that can occur in children as they recover from a simple common cold. Here to explain is Dr. Kristen Moffat, an infectious disease specialist at Boston Children's Hospital. Good to see you, doctor.
It's good to see you, Dr. Moffat. So the CDC has been tracking cases of what's called, and if I say it right, if I don't say it right, please correct me, acute flaccid myelitis, or AFM, right, for nearly 10 years.
Yep.
It's very rare.
Right.
There are only 721 cases total in the United States, and there are, 330 million people that live in the United States. So it's very rare. But what can you tell us about the symptoms and the cause?
Yeah, so the most typical symptoms of acute flaccid myelitis, which you pronounced great, we'll call it AFM just because that's easier. The most typical symptoms would be a sudden onset of weakness of the arms or legs. Some people may experience a facial droop or potentially difficulty swallowing or slurred speech if they were affected by AFM. The cause of AFM can be a number of different viruses, but over the last 10 years, it's a group of viruses belonging to the enterovirus group that has been most commonly found in patients with AFM. Enterovirus is a large group of almost 100 viruses, including the polio viruses, which we know could cause a serious neurologic disease before vaccines were available. But it's enterovirus type 68 and 71 that have been most often found in patients with AFM. But again, the majority of enteroviruses just cause the common cold.
Can we take a look at the data so far this season? 42 cases confirmed, 1 in Massachusetts, 1 in Rhode Island. An additional 40 cases are still under review. But again, even added together, it's really just such a small number. So how do you explain why these kids are developing AFM when nearly everyone else did not?
Yeah, it's a great question because, again, enterovirus infections are so common and such a small number of people develop AFM. It's not really understood what might make a child more susceptible to developing AFM. One hypothesis is that it's actually an abnormal immune response to an enteroviral infection that can affect the spinal cord and lead to the symptoms of AFM. Another possibility is that there may be a genetic factor underlying that makes someone more susceptible to developing AFM, but it's really not known yet, and these are actively being investigated.
Dr. Moffat, I'm curious because you mentioned symptoms similar to polio, and as you mentioned, and as everyone knows, there's a vaccine to prevent polio. So is there any way to prevent AFM?
Yeah, unfortunately, there's not a vaccine that is currently available that would prevent AFM. Part of the issue is we need to better understand what the different causes of AFM might be to know whether or not a vaccine to prevent it would be feasible. But in the meantime, we know how enteroviruses are transmitted, and we know that enteroviral transmission can be reduced or prevented by really careful hand washing and by avoiding people if they're sick. So those would be some good first steps to stay healthy and avoid enteroviral infections.
All right, Dr. Moffat, thank you so much. Stay well.
Great to see you, Dr. Moffat. Thanks for your time. Closing in on